more specifically pregnant women. And we are also joined by a medical professional, Dr. Kevin Henry. He is the doctor of medicine focusing on obstetrics and gynecology. He currently practices as a senior registrar at the Department of Obstetrics and Gynecology at Spanish Town Hospital, and is the co-founder and director of Women's World Medical Suites. His special interests include fertility and reproductive health, and he has a particular passion for advocating for the improved and better healthcare of women across Jamaica. And we're really excited to have both of you here. Especially happy to have Dr. Henry, who is actually on call. So we will allow him, if he has an emergency, fingers crossed that there won't be. But we will get straight into the discussion. Thank you so much for joining us, both of you.
Thank you for having me.
Thank you for having me as well.
So I'm just going to get right into it. We have a series of questions, and hopefully as we go along, as I said, persons are able to ask questions through the chat option as well as through the raise hand option. So please feel free to do that, ask questions in the Q&A kind of tab at any point in time, and we'll get to them during the Q&A section. And we also have a number of polls which you can feel free to respond to, and we'll share the answers towards the end of our discussion. So I mentioned earlier that our research indicated that abortions are still taking place, despite the fact that it's illegal in Jamaica. I think the statistic is that 20,000 to 50,000 abortions take place each year, despite this ban. Dr. Diniz, I just want to ask you, kind of point blank, why is it that banning abortions doesn't stop abortions from taking place? It seems to be a fairly counterintuitive idea that it would do the opposite of the intent of its intention. Can you speak a little bit about the illegality and the adverse reaction it has?
Yes, and really thank you all for having me today. And I want to compliment you for the impressive report that CAPRI put in front of us. So really, congratulations. Your question is a very good one, because as you said, it's counterintuitive, because we imagine that having a legislation that says that something is against the law, it will refrain people of taking some specific behavior, such as an abortion. But we need to reframe what we have in front of us. Abortion is a health need. It's something that women and girls, in a moment in life, when I mean girls in the situation of sexual violence, but let's speak particularly about women. Women in a moment in life, they will see themselves in front of a health need, and they need just to know how to access the procedure in a safe and legal situation. So the legislation does exactly the contrary. Making abortion illegal increases the rates of illegality. And you can say, but how come it's possible? Because when a woman is in need of abortion, is that something in her life is not properly correct, or she's using a contraceptive method in the wrong way, or she's a victim of violence. And because of the illegality, she will not arrive at Dr. Henry clinic, and she will not speak the truth. She will not tell him, doctor, something is happening in my life and help me. She will say, look, it's a miscarriage. I don't know what is happening. And the doctor will not have the opportunity to prevent a second abortion, or even to do whatever that we call harm reduction. So to reduce the risks of such a woman to put her life in risk.
Thank you. And actually, your answer leads me to ask Dr. Henry the same question. You know, on the ground, having worked across public hospitals in Jamaica, Dr. Henry, do you find that this is something that you and your colleagues are faced with? Are there issues where women are coming in and pretending that they haven't had an abortion? What are some of the experiences that you've had in terms of the difficulty treating women?
Yeah, well, that is definitely an issue that we face, not only in the public sector, but privately as well. So I think that because of the mere fact that abortions are illegal, and so by law, both, the physician and the patient or the woman who attempts an abortion, by law, are if found that it is done, then it could face punishment. You find that women will come in and have complications or issues because of an abortion, but when you try to get to what exactly happened, you get a lot of different stories as to what took place. But a lot of times, us as doctors know ways to tease out the information, and then you can tell whether by the history that the patient gives, or when you examine the patient, you know that okay, this is most likely an abortion that was either attempted or has been completed. In addition, what we are finding now is that more patients are coming forward and saying it. So I wouldn't want to say that it is them admitting it. They will just say it. So we always ask upfront, you know what happened, and then we will ask them directly as well, did you attempt anything,
Okay.
by any means? So the patients now I find are more forthcoming with the information, but it still remains the fact that there are a lot of women at varying ages, teenagers, young women, who, for fear of potential getting in trouble or prosecution, and I guess because of the stigma that is associated with abortions, will withhold that information and they won't tell us. And it is not all settings where you may have qualified, medically trained professional in the specialty or in the field of obstetrics and gynecology have that expertise to be able to offer, quality care. So if you are going off, so for somebody else who's not necessarily that well equipped or that well trained, going off a history that the patient did not attempt an abortion when they actually did could actually cause the woman more harm than good.
Yeah, and I think one of the things that was born out of our research as well is that the same experiences that you just kind of navigated us through are disproportionately present in poorer and younger women. So we know that 20 to 50% of teenage pregnancies end up in abortion. And we know that younger girls from inner city areas are twice as likely to start engaging in sexual activity at a much younger age and subsequently getting pregnant at a much younger age than their wealthier and more educated counterparts. Dr. Diniz, I wonder if you could talk about whether or not this is something that you see in kind of across the region, or is this something that's unique to Jamaica?
It's not unique to Jamaica. We are based in the region that criminalizes most abortion in the globe. This is really important to keep in mind. Latin America and the Caribbean is the region that criminalizes most abortion as a health need. And when we say about criminalization, we say about putting women in jail, persecution, is using the criminal law to increase the stigma, to threaten these women, and to moving abortion as a health need to clandestinity. And everything that is related to clandestinity will be increasing the risk of having a procedure that is safe if well informed and done in a proper way using medicines or having medical support. So we live 90% of women at reproductive age in Latin America and the Caribbean, they live under restrictive laws. So we're talking about an imminent risk to women. If you go to Brazil, abortion is against the law, and we have just 3 exceptions in case of rape to save the woman's life, and in case of a very specific fetal abnormality that is anencephaly. In all the other circumstances, women can be put in jail if she has an abortion. But even having such a brutal legislation, 500,000 of Brazilian women have at least one abortion every single year. We're talking about 500,000. We can discuss later how do we know that, even knowing that abortion is illegal. But we are talking about a huge number
Yeah.
of ordinary women that in a moment in life will take a decision that is risky because of the law, that is not risky because of the procedure. This
Yeah.
is really important that Dr. Henry, in a moment, could clarify to us.
Yeah, and that's exactly where I was going. So I think one of the popular narratives around, or one of the arguments against legalization of abortion is that it's this inherently unsafe procedure. And Dr. Henry, I wonder if, well, first of all, what is an abortion? What is a termination of pregnancy? What does that process look like? And then are abortions inherently unsafe? What are the risks associated with an abortion that is carried out by a trained medical professional who is obviously well capable of doing such a procedure?
Okay, so an abortion is, I mean, to put it in its simplest form, it's a termination of pregnancy, right? So it's ending the pregnancy, which can occur at various stages. So an abortion can be done, roughly speaking, in two ways, right? So the first way is medically, so that's with the use of medication, where commonly it is some form of tablet that is given, which essentially acts to cause the uterus to contract and push out or expel whatever pregnancy or products of conception are there. The second way that an abortion can be done is surgically. So that would be a procedure whereby certain devices or instruments are introduced or placed inside the uterus to remove whatever products are there or a pregnancy that is there. Now, it's difficult to comment on abortion specifically because in our setting, as we know, it's not legal, right? But technically speaking, the procedure is similar to something that we do commonly for women who are experiencing miscarriages. It's pretty much
Okay.
it is almost the same procedure essentially. So as part of our training as gynecologists, that is what we are trained to do in terms of
Okay.
if it is that a woman has a miscarriage, which is basically a pregnancy loss, in terms of it is the same procedure, medication in the form of tablets, or do it surgical, or a combination. So that is what is done in terms of a procedure. So in terms of the safety of it, with all procedures or of any type that is medical, there are complications that are associated. Okay? The complications, however, are significantly decreased or are less once it is done under controlled circumstances, once it is done the proper way, and once it is done in the expertise and the hands of persons who are properly trained or medically trained to do it. What happens in our setting is that because abortions are illegal, there are a lot of times where they may feel reluctant or hesitant to go to medical professionals. And naturally so, because it's fear of being executed. And so they would seek others, or it would be that they would seek medical attention and are turned away because it's illegal. So they seek other ways or other means of terminating the pregnancies. And that may or may not be in the hands of somebody that is trained to do it. And therein lies the problem in terms of that is what usually increases the risk of complications. Because now you have a woman who is being terminated under circumstances which would necessarily be controlled. The medical setting for that to occur. And there is question a lot of times in terms of who is doing the procedure and what is being done. Of course, as well, if it is that, women are accessing things on underground markets or the black markets, then there is no official government medical advice for them to receive in terms of what should actually be done. And that is a big problem in and of itself. So people are doing all sorts of things to pregnancies. And then we see it at the back end when they come into hospital.
And what are some of the complications that arise when women attempt to take matters in their own hands or seek advice or support from an untrained person?
So a common complication, or one of the most common complications, is bleeding or hemorrhage. And so if it is that termination was attempted but was unsuccessful, you may have continuous or heavy bleeding. And so if you're just having bleeding continuously, and you're losing a lot of blood, then the patient will become unstable, anemic, and that is actually one of the leading causes of maternal mortality worldwide. In addition to bleeding, another common complication is infection. So we call that a septic abortion. Sepsis basically means it's an overwhelming infection. And so if it is that the procedure was done in an unsterile environment or in an environment that is not clean, then the risk of infection increases. If the instruments aren't properly sterilized, if whatever is being introduced isn't the proper thing, then they're on the risk of sepsis, which is also another cause of maternal mortality and morbidity. In addition to sepsis, a fairly common issue is that most pregnancies are inside the uterus, okay? So 99% of pregnancies are inside the uterus. 1% of pregnancies, however, are not inside the uterus. They're outside the uterus. That's called an ectopic pregnancy, which is not in the uterus, okay? So what should actually be done before any attempt to empty a uterus that is pregnant is an ultrasound must be done to confirm where the pregnancy is. It is the same for patients who have a miscarriage. You have to ensure that that pregnancy, whether it is alive or it is not viable, is inside the uterus. Because if the pregnancy is outside the uterus, the management and the treatment is totally different. Mm-hmm. So what you will find happening is that women will present with a positive pregnancy test, go to wherever and say, "Oh, I'm pregnant and I want an abortion." There is no check there's no check in terms of an ultrasound to determine that yes, this pregnancy is inside the uterus. They're given tablets or pills, or the procedure is done with the assumption that the pregnancy is inside the uterus. So the woman feels that she's fine, and then 3 or 4 weeks later, that pregnancy, which is now outside the uterus, has now ruptured on the inside, and there's bleeding inside the tummy, and it is just a catastrophic event. So there are a lot of associated risks with attempting these things when it's not done under proper medical control. Not to mention, all of the, as I mentioned before, all of the various, you hear, this friend is telling you that this works for abortion, herbal remedies, a lot of different things which can actually be very harmful to your system. Mm-hmm. So it's a number of things to look at the complications. And sometimes because these things are properly explained to them when the procedure is done, they may, you may just hear, okay, well, yeah, you may have a little bit of bleeding, but that's normal. You may have some belly pain, but that's normal. And it's not until you have literally almost hemorrhaged out that is when they present to hospital. It's almost too late sometimes.
Right.
It's a lot of things to consider.
Wow, that's all. And I think it's really impactful to know the number of, go ahead, Dr. Diniz.
Yeah, can I say it's a typical Brazilian way, really? I don't know if it's jumping in saying something.
Please.
But while I was listening to you, Doctor, I thought it's a handbook of tragedies. But everything is caused because of the criminal law. Doctors and women, they know how to have an abortion in a safe way. We have by WHO, the World Health Organization, there is a proper recommendation for self-managed abortion that is taking pills. But what we need to know is that we take pills that are really pills, it's not
Yeah.
fake pills. So the issue here is that all the risks that we are faced is caused by the criminal law. And the question is, why do we need criminal law for a health need, for something that we know how to take care of women and how women know how to take care of themselves? So when we discuss that we need proper care, it's basically access to information, because women can do abortion by themselves using proper medicine. So my point is that when we discuss the worst case scenario, we need to come back to the question, why are we criminalizing something that is a health need? Going back to the Brazilian numbers, we're talking about 1 in 5 at the age of 40. Can you imagine that every single family in this country would have a woman that was in jail, your grandmother, your mother, your sister, your daughter, because of a basic health need that we know how to protect and how to reduce the stigma. So I'm really impressed hearing Dr. Harry about all the risks that we could avoid just moving abortion from
Yeah.
the criminal law to the public health issue, as Colombia, the Colombian Constitutional Court, is doing those days. It's the first constitutional court in Latin America and the Caribbean that is facing the proper question. That is, why do we have abortion in the criminal law?
Yeah.
It's not a matter of criminal issue.
Yeah, and actually, one of the things that I wanted to talk to you about, having had this wealth of experience doing advocacy and kind of community leadership projects and all of the research that you've done around this area, what are some of the changes that you've been able to see within the region? I know recently Argentina decriminalized abortion, and it is a very religious country. And in Jamaica, I think one of the main objections to legalizing abortion comes from a religious perspective. So I'm wondering if there are lessons that we can learn from that experience. What took place to create that shift?
I love your question, because Argentina is a very Catholic country and the Pope is from Argentina, right? So if there is a moment that we could say it would never happen, it would be having an Argentinian Pope. And it happened. And it was under COVID. Do you remember, Dr. Levin?
Yes.
So
yes.
1 million women and girls in the streets saying, we need to change it. And we call this movement as the green wave, because they use the green bandana. And this is very symbolic. I don't know if you know the story of the bandana. During the military dictatorship, that most of the countries in Latin America and the Caribbean had military dictatorship in the 70s and the 80s, and some countries even later. And when women started to ask, where are my kids? What happened? So they used a white bandana, a white bandana in their heads, and saying to be seen by the window of the parliament, and they were in the streets and in a square saying, we are here. We would like to know what you have done with my kids. So when the generation of the granddaughters of those women, they started fighting for abortion decriminalization, they used the same symbol, but now in a green color. It's a beautiful story, right? Because you have the roots of our ancestors. All the fights for women's rights are connected. But responding to your question, at the same time that we are living in the region that criminalizes most abortion, we are living in the rising of the green wave across the region. So we have Ecuador with a recent change in the abortion legislation. We have Colombia that we expect a decision from the Constitutional Court by next week. We had Mexico last August.
Is really to make sure that women don't need abortions as much, so, or don't need abortions at all if necessary. So what are some of the things that you need from a medical perspective to create this shift?
So I think that's a very heavy question because in order to decrease the need for abortions, we first have to look at why they're being performed in the first place. You know, a lot of the discussion so far has been based on, slanted towards the laws, which we know and we recognize, but we also have to look at, why is it that women are performing abortions? Is it that there is less access to information about pregnancy on a whole? Is it that there is, decreased access to contraception? Is it that women or girls are facing more, domestic violence, and so, there are cases where girls are getting, it's an increased number of unwanted pregnancies? Um, is it that the access to healthcare is an issue? So it's a number of things. I I think it was sometime in the 1970s, if I'm not mistaken, or in the 60s, when the issue of contraception came up in terms of access to contraception. And there's the development, the advent of the National Family Planning Board, which then made contraception in and of itself more accessible. So I think that is one of the things that we definitely need to push greater, educating our girls and educating our women from a young age. So from high school as early as possible. The reality of it is, a lot of sometimes there's a bit of hesitancy or resistance from parents, both mothers and fathers, in terms of talking to their children, educating them about sex and safe sexual practices and so forth, because maybe it's just a reluctance to face the reality that kids are having sex. It's happening, right? And it's happening at younger ages, whether they want to accept it or not. So instead of trying to avoid the problem, it is better to try and tackle that head on, to get that knowledge there, because in addition to the unfortunate cases of domestic violence or, rape, incest, whatever it is, a lot of times teenage pregnancies are caused because kids at that age are curious. They're doing whatever. A lot of things are happening, and they don't know the consequences of the repercussions of their actions. So, one is bigger campaigning for it. Two is the availability of access to contraception, as there are multiple steps. It is something that needs to be discussed with both the women or the kids, parents, so everybody is on board. Further from that, it is not about planning in terms of family planning. So, as best as possible, it should be that pregnancies are occurring when they are both planning and pregnancies. We also know that the reality of the situation is that most pregnancies aren't happy, and a number of pregnancies are now, when it comes to the I think there's a great divide in terms of access to abortion. Two, because in our setting we are without medicine, and so but in addition to that, it is, will it be that women are now using an abortion essentially as a defense? Which again comes back to, because it shouldn't be that now there is, but if it's illegal, then it's all to be pregnant. Let's face it, if it is that there are, if it is that abortion means the woman it's complications or risk. It's a lot of things to look at, but I think that we need to start with education for sure. I do believe that changes in the laws or amendments to the laws would help greatly in terms of reducing the complications of that situation. To deal with certain situations, then.
Actually, we have a question for, well, I'm going to ask Dr. Henry while you're speaking. Are doctors legally required to report patients who admit to having an abortion? This is coming from Daniela Malcolm. Thank you for your question, Daniela.
To report patients, to my knowledge, no. I would need to double check that, but to my knowledge, no. If it is, we are required to report if there is any sexual act for minors, any patient that is under 16 engaging in intercourse, that we have to report. But for an abortion, I am not sure, but I don't think so. I'm not sure.
Dr. Diniz, just following up on Dr. Henry's point about the things that are necessary to create this shift beyond just having access to abortion legally, you refer to something in your research called the critical abortion path. Could you speak to that a little bit and talk us through that?
Yes. First of all, I would like to say that I want to second everything that Dr. Henry said in the response about how to reduce the magnitude of abortion. And we call it comprehensive sexuality education, but also recognizing that we have situations of domestic violence, sexual violence, and we need to speak about it as a comprehensive package of things that we need to tackle to protect women and girls. But this idea of a critical path, this concept is not mine, but basically it means that there is a moment that when a woman reaches the hospital, the clinical facility, imagine that Dr. Henry is at the end of this critical path. She will pass a lot of barriers for someone at the entry door asking, "What are you doing here? Why are you bleeding? Did you do that by yourself? It was induced? Is a miscarriage?" So she has to face a lot of barriers and a lot of, questions that are not neutral. And until the moment that she will face a well-trained and sensitive professional like Dr. Henry in this conversation, she has a lot of reasons to run away and to avoid trusting someone that can take care of her, or even to offer her a proper information about what is happening and how to avoid and how to inform other women. Because what we know is that a valuable source of information is women to women, because we
Yes.
keep saying the information of getting medical proper information from a medical setting, but we know that as women we take care of each other, we share information among us, and this is really a valuable source of protection and reducing this the effects of a unsafe abortion among women. So the critical path is the moment that she crosses the the door of a clinic facility or a hospital, and we need to take care of her in the proper way and not amplifying the stigma. So I would like to sum my response to what Dr. Henry said. One thing is specifically about the Jamaican law, but not just looking to the criminal law, but let's look to the medical ethics. The duty of any medical professional is to take care of who is suffering in front of him or her, and not questioning the source of that suffering. And if she or he knows how to take care, is what it matters.
Right.
A physician is not a police guard. And when we cannot mix both, professions and powers, we need that a woman will be fully confident that that physician that will take care of her suffering is someone that will take care about the confidentiality and privacy
Yeah.
of whatever will be said.
Yeah. No, definitely. Um, we have 4 minutes left, so I'm going to ask one last question to wrap up. So, we are in the middle of a pandemic, and one that may not be going anywhere for quite some time. Dr. Diniz, I'm wondering, and maybe I should ask Dr. Henry first, have you seen kind of increase in women coming forward during this time? Have you seen increased pressures around pregnant women coming forward, or women getting pregnant and not being able to access resources? And then following on from that, Dr. Diniz, you've done some research around this issue, and I'd love for you to share kind of some final thoughts on that as well. So Dr. Henry, if you'd like to go first.
Okay, yeah, well, definitely there has been an increase in terms of just, well, in from what I have seen in pregnancies in general. So
Okay.
because of the lockdowns, we have seen that there has been generally an increase. So sometimes we have what we call, or what we refer to commonly as peak seasons. So a peak season is when there is usually a higher number of women, delivering. And that peak season usually is 9 months after Christmas, because everybody usually gets busy in Christmas. So that's around September, right? What we've been seeing in the hospitals is that there are more peak seasons now. So you may have, 2 or 3 peak seasons in the year, and that is simply because there are just more pregnancies which have coincided with the lockdown. So by virtue of the fact that there are more pregnancies, there's also a consequent, increase in the attempted terminations or attempted abortions that we see as well. So
Right.
that's something that we definitely have seen.
And Dr. Diniz, what has some of your research, if you can give us a kind of synopsis in a minute, shown about the impact of COVID on the issue of abortions or legalization of abortion?
So Brazil is one of the epicenters of COVID, right? And is the epicenter of maternal mortality of pregnant women due to COVID. So something is happening there. If it's not something that is a natural cycle of the virus, it's something related to how we respond to the pregnant people, pregnant women needs. when it crosses with the stigma in the criminalization of abortion. So we are now investigating why we have such a concentration of maternal mortality due to COVID in Brazil. And our main hypothesis, and we're conducting interviews with the family members of women who died, that is basically what happened when she got the critical path,
right,
and she was denied care, and
so
why.
It's a matter of access again.
And a matter of recognizing her as the patient, and not this false dilemma that as she's pregnant, I have two patients in front of me. Is a false dilemma. What you have in front of you is a woman that is seeking care. And you need to do whatever you know in the best science available, how to take care of her.
Wow. Thank you so much for joining us. We are running out of time, and I just want to thank you both so much for kind of helping us to disrupt some of these stereotypes and norms around abortion. And hopefully you can join us for our next conversation, which will be around children in state.
Want to learn how to use the internet to do everything from paying bills to earning an income online? Let the digital